Jaime from Bioman. In the next 2 minutes, I'm going to show you all about megotherapy. Medical class Nachratana. Do you know what it means? It means the doctor administers the cure, nature does the healing. Some people say, I have so many doubts about using maggots as medicine. However, in fact, they should bear in mind that the best number of drugs come from nature's pharmacies. Building from the saliva of the medicine-rich bats and snakes. Antibiotic penicillin is fermented from a mold that contributes the compound to kill its bacterial competitors. Nevertheless, in this fact, few people realize just how much the pharmaceutical industry depends on natural organisms for drug manufacture. My goal is to inform medical professionals the use of megotherapy through this presentation. The purpose of that I want to advertise new methods of wound care. It might be very useful for wound care surgeons, patients, and so on. Let me switch gears now. I will tell you about the fly. There are over 100,000 species of flies representing a variety of shapes and types of habitats and of behaviors. Yet they all have in common a four-stage complete metamorphosis by which they develop through the stage of root, egg, larva, pupa, and finally others. In this life cycle, larva used as a therapy. In theory, there are so many species of flies in the world. In addition, 11,000 species can cause disease one or more ways. As vectors carrying parasites within their own body, and somites mechanically transport proteins, infectious bacteria or viruses from one side to another, whereas parasites rather breeding and feeding on the tissues of these vertebrate hosts. Unlike some fly species, the members of the general Painiaceae catamagots neither transport infectious agents nor cause disease. By that I mean Painiaceae catamagots never develop damage. They are commonly known as green glove flies because of their iridescent golden green color. The larvae of Painiaceae cata have a prominent claw that can hold and store large quantity of food until it is later released. The glands that contribute the digestive enzymes, the powerful suction apparatus, and the extremely dispensable claws are evolutionary adaptations that reflect the main purpose of the larval stage. They need to ingest a large quantity of food as quickly as possible, storing some of it for later use during the migratory and pupa stages. In its short lifespan of non-stop feeding, a single maggot can possess as much as 0.3 grams of nutrient substrate, or reported tissue or tooth and wound glue. Okay, let's return to the subject. I will talk to you the mechanism of megotherapy. First of all, it is about the debridement. The maggot removes necrotic tissue by separating digestive enzymes and by mechanically scraping the wound with their knuckles and fine. Second, about the antimicrobial action. The maggot flushes the wound by greatly increasing fluid production in the wound. The maggot secretes ammonia, calcium bicarbonate, and iron. The pH of the wound rises during megotherapy. Large quantities of bacteria are killed in the acidic portions of the larval digestive tract. Proteus myelitis of bacterium in the digestive tract of maggots contribute substances that develop bactericidal effects in an acidic environment. Laboratory studies have shown that the fluid secreted by maggots potentially kills a number of microorganisms, including MRSA. The maggot activates white blood cells while stimulating wound healing. The larval immune system contains antimicrobial substances. Finally, study about the stimulation of wound healing. The method mechanically stimulates wound tissue and releases allantoin, urea, and ammonium bicarbonate secreted by the method promotes wound healing. The fluid secreted by the method promotes cell growth and cell division in cells. Hormones have also been found to stimulate the growth of cell cultures on regulatory experiments. The method secretes messenger substances that act on tumor cells. The method is to generalize it. Variation of host immune system. Patients with acute and chronic wound infections, especially those living diabetic wound healing disorders, are good candidates for megotherapy. The efficacy of megotherapy in the management of treatment resistant wounds such as diabetic foot ulcers, infected pressure sores, and burns has been employed documentally. Fly larvae ingest contaminated fluid from their immediate surroundings soon after hatching and can no longer be sterilized. However, the embryo inside the fly egg is sterilized and the membrane enveloping the egg is extremely resistant. Therefore, fly eggs can be sterilized by disinfecting the surface of the egg and allowing the turning larvae to hatch in the sterile container with sterile culture media. And as you know, BioMold will use the sterilizing processing for your order. There are two ways to apply methods. The one is pre-arranging method dressing system, and the other is biobag, allowing markers to grow freely on the wound surface is not optimal for some wounds. Sometimes it's preferable to prevent the maggots from roaming on fragile tissue or into a deep cavity, just benefits of necrotic wounds. Furthermore, direct exposure to the maggots, sharp, mouth hooks, and picules can be painful for some patients. Also, it takes more time, effort, and training to properly dress a wound using free-ranging maggots, as opposed to maggots confined in bags. Two major designs are being used. Both of which completely enclose the maggot fly larvae can develop and have healed chronic wounds in a form of biosurgery. I want to finish with this paragraph. For centuries, fly larvae have been used successfully to treat wounds. However, once penicillin was discovered and antibiotic therapy became common worldwide. And now that bacteria are becoming increasingly resistant to modern antibiotics, mammotherapy is experiencing a resurgence. This is a pretty interesting trend. Those are hugely important aspects to think about medical technology. Thanks so much for allowing me to talk to you today. Thank you very much.